Cancer is now a leading cause of death globally, surpassing HIV/AIDS, tuberculosis and malaria, with Nigeria accounting for over 102,000 cases and 72,000 deaths annually from 2022 to 2025. That's according to the National Institutes of Health.
Too many Nigerians still face barriers to prevention, early detection, diagnosis, treatment, and palliative care. Addressing these inequities is at the heart of the mandate of the National Institute for Cancer Research and Treatment.
Thankfully, cancer is now a notifiable disease with cases reported to the National Cancer Registry. However, treatment costs remain a major issue, driving patients to seek alternative treatments.
We have worked with women who discovered cancer late because screening was unavailable. We have met families who endured financial hardship in the search for treatment. And we have also witnessed extraordinary survival stories, which proves that early detection, timely treatment, and compassionate support saves lives.
Treating cancer is very expensive. I know at some point, my husband, all the savings we had, we used it to even start. We've not even started treatment. It was just the scans and all of that, and then money has gone. And then they now said we'll do chemo, and it's every three weeks. And you're talking about 300 for every three weeks, depending. It's even some patients pay like up to millions and all of that for just chemo.
To address this, the National Institute for Cancer Research and Treatment has launched a free nationwide cancer screening initiative, and the government is introducing cost-sharing schemes and subsidies.
We continue to budget every year on the average of about 200 million for the Cancer Health Fund, but we recognize that that amount is not enough. So we're looking at a more sustainable approach, which is introducing the catastrophic health insurance, which has a more sustainable way to deal with it.
When we screen you and we discover that we are just in stage 1 or stage 2, the lower one, we treat you immediately with what we're about to show you. So we have all of this, and what did we do? We deployed a non-invasive technology. That technology is called a mobile corpuscle.
We are forefront, and they're working with the government supporting the human papillomavirus vaccination, which is part of the preventive activity among the girls.
Effort is also being made to improve access to diagnostic and treatment capacities of our healthcare workers and institutions through training and retraining.
Experts say more needs to be done, which are enhancing policies, more diagnostic services, awareness, and treatment facilities are crucial to improving cancer care in Nigeria. Olije Wapera, Arise News.
Well, thank you, Olije. Now, in commemorating World Cancer Day, we are taking a look at the cost of cancer treatment in Nigeria and the fate of underserved patients. And joining us is Professor Usman Aliyu. He is the Director General of the National Institute for Cancer Research and Treatment. He is joined by Dr. Dennis Ejoh, founder and CEO, Commodore Cancer Foundation. Thank you so much for being on the news tonight, both of you. And I would like to begin with you, Dr. Dennis Ejoh, because I read your story and read your profile. You are a survivor, a warrior, I must add. And you were diagnosed with metastatic breast cancer. That means it had spread, even though it has spread by the time they diagnosed you.
It's still there.
Yeah, okay, great. So it makes it even more compelling and interesting at the same time for many people watching tonight. When you received your diagnosis, what was the hardest thing for you to process? Was it the disease, the cost? What was it like?
Okay, the first thing that happens to a cancer patient is you die first. Because everybody knows, once you hear the word cancer, there's nothing. It's supposed to be a death sentence in the context. So you die. Then you have to wake up and say, okay, what next? And at that point, this journey starts. So for me, when I got it, I had a child who was in JS1. And so now you have to think about family, who's going to look after if I die, because I knew I had last post-op. I have a metastatic disease, which means it's moved to stage 4, and that means that nobody's promising me life anymore. So it was making choices at that point on what next. So I will put two things in context. I was fortunate to be able to fly out, and so I had brain surgery within 2 weeks. But I have continued to have, I take cancer and chemo every day. And for 9 years, I've lived like that. So there's nothing I can do. I've had more than 15 tumors removed from my brain. Although I have metastatic breast cancer, the tumors are evident in my brain. And so when you look at that part, faith plays a very big part in a cancer patient's journey. But our everyday life, if that is not balanced properly, then even if you have a lot of money, you don't end up fighting it properly. So first we've got to get our mindsets correct, which is the support and help we get from everybody else. And then we are then prepared to walk the walk with the drugs that and if you got I've got a fantastic consultant, but some people don't, and then it doesn't work for them.
Denise, well, I mean, one could actually spend all night to hear from you how you've walked through this experience, especially considering the fact that it's not necessarily in remission. No, you say it's still there, like so that. You're still dealing with it. Let me bring in Professor Usman Aliyu. I mean, the challenges that cancer patients have to face in Nigeria is like a death sentence, if not a death sentence, actually. I mean, she was fortunate, that she was able to go abroad and get the best help that she could. Where are the gaps in Nigeria? What exactly are the challenges? Why is cancer diagnosis still a death sentence in Nigeria?
Well, thank you very much for that question. As far as we are concerned currently now, cancer diagnosis is actually not a death sentence. You can see a testimony from her, I can see. The problem we are having with Nigeria, Africa, and the lower middle income countries is in called late presentation. So
late presentation.
Okay. Now we have like more than 70% of Nigerians now presenting at late stage. And when you present late, the treatment options that we have are limited. And the cost of care skyrocket, it shoots. As against if you present early. Now for those that present early, the cost of care is minimal. It's something that on the average can afford, and a patient can be cured, and that's it. And that is why currently the present government of Ahmed Bola Tinubu, under the renewed hope agenda, has mandated or directed our coordinating minister, the two ministers that we have in the Federal Ministry of Health and Social Welfare, that is Prof. Muhammad Alipati and Dr. Isiaq Adekule Salaku. They mandated the institute, that's the National Institute for Cancer Research and Treatment, which is an agency for cancer control, and it is the implementing organ of the ministry, to actually establish screening centers for the country. So we currently have 8 that are distributed in the 6 geopolitical zone of the country, and we are currently running a program which we tag NICE Scan. We have mammography machine in there. We have all the required kits for prostate cancer. We have ultrasound and so many other things. So aside from the screening itself, an individual can actually go and have like a kind of health education to inquire more about what causes cancer, what are your chances of getting cancer if you have a relative that's cancer. It has never happened in the history of the country. This is the first time. we're seeing that. So kudos to the government of Ahmed Bola Tinubu.
Okay. All right, Dennis, let me come back to you because you have Commodore Cancer Foundation, and I imagine that you deal with cancer patients more often than not. But why do they present late? Have we been able to identify the root cause of that? And what hits them the hardest, the most? Let's talk numbers. Is it the treatment, radiotherapy, chemotherapy, diagnosis? What exactly hits them the most?
Okay, so firstly, why do we present late?
Yes.
I don't think there's enough education about what you need to do. So I had a headache, but I've just said to you I have metastatic breast cancer. So the first thing is, what's the relationship with breast
And headache.
and headache? Yeah. And if we're told today that ordinary diarrhea can be cancer, people will be more serious about it. But we are not told that. So I'm starting to find that out because I had a headache. And so that's number one. So education, cancer education, in my view, should start earlier so that children are aware and they will educate their illiterate families, and then we are more likely to get into the communities earlier, because if they know, then they'll do it. So that's the first one on
Why they present late.
why they present late.
Right.
And the second one is,
What's hit them the most?
what has hit us the most?
Yes.
I don't say there is us. What has hit us the most is the cost. Unfortunately, it is, I say, we're the most expensive begging community in the world, not just in Nigeria, across the world. Because cancer patients always have to beg for treatment, beg for food, beg for rent, beg for their children, beg for, and everybody gets tired of us. And so after some time, because it's assumed they're not even going to make it, people tend to walk away, which has a very big knock-on effect on your mental health going forward. So if you don't have money, if you even have small money, which you will find we have, then you now have to add up. Do I use it for cancer treatment, or do I use it for my child's school fees? And so a lot of cancer patients even give up the journey because they've got families to look after. And until the system looks at us as, and I always insist, look at us as a human being, not as a cancer patient, and say, okay, this person, if you had malaria, you can find medicine for malaria. Why don't you see cancer as malaria and help us from the beginning? Because there's a lot of adverts on malaria, right?
Yeah.
But how much advert is on
And
cancer?
over-the-counter medications.
But how
and
much
what have
advert
you.
is on cancer?
Right.
Even to talk about it in schools. No. We're not allowed, you see. So there are too many restrictions on the learning about it, that if that was done right, I think we would actually be in a better place for the next generation.
Professor Osman Aliyu, how do you now close the funding gap, including, of course, the care gap? Because there's that challenge, you know, I mean, caregivers actually have to give up their lives too, I can imagine, you know, to take care of, you know, cancer patients and all of that. How do you close the gap? How do you help people living with this, you know, disease that ordinarily should not be a death sentence, especially in Nigeria? In practical terms, what are the policies that are being put in place to, you know, help the situation?
All right, so part of the things that the government is currently doing to help the people that are, you know, affected by cancer is one, to improve access to the one, equipment for diagnosis and for treatment. Now, having, I mean, just let's say some few months back, the Honorable Coordinating Minister for Health, Prof. Muhammad Ali Fateh, launched an additional 6 cancer centers, you know, in the country, which are currently
Making it how many now?
making it 12 now.
12 cancer centers in Nigeria.
Yes.
And they're really accessible, not just to people in the cities, but people
So they
who
are
left behind.
they are distributed widely across the 6 geopolitical zones in the country. Each zones, you know, has at least one or two machines, you know, for the treatment, and that actually has improved access, you know, to the treatment. Currently, we are working to very soon. We're going to provide what we call and upgrade our brachytherapy machines that we have in the country. Brachytherapy machine is actually a radiation therapy machine that we use in the treatment of cervical cancer and prostate cancer, and we are currently working to actually provide those machines for 6 geopolitical. Very soon, maybe before the third quarter of this year, those machines will be functional across the 6 geopolitical zones. So now if you provide the diagnostic and the treatment equipment for the machine, what next?
Yeah.
The next thing is affordability.
So there's a challenge
So
there.
affordability is actually a challenge, generally. But to in this vein, the government actually has what we call the National Cancer Health Fund, which is purely meant for the indigent cancer patient, that is those patients that cannot afford the care of cancer. So they can be enrolled, through the hubs that we have in the country, that is the 6 cancer centers of excellence, and they can access the care.
Okay.
Now the government also went ahead now and
very quickly, doctor, we have to wrap up.
Yes.
Very quickly.
Okay, establish what we call the Catastrophic Health Fund with the National Health Insurance Scheme, and cancer is one of the things. So it's meant for those that have, insurance.
So apparently a lot of public enlightenment has to go so that people can actually access these facilities. Professor Usman Aliyu, DG, National Institute for Cancer Research and Treatment, thank you very much for joining us. Dr. Dennis Ejoh, founder, CEO, Commode Cancer Foundation, thank you so much. Your general outlook would encourage anyone out there, your optimistic, spirit. Thank you very much for joining us on Newsnight.